The small intestine is a crucial part of the digestive system where most of the digestion and absorption of nutrients occurs. It is a long, coiled tube connecting the stomach to the large intestine. Here is a detailed overview of its structure, functions, and clinical significance. Structure. The small intestine is about 20 feet, 6 meters long in adults and is divided into three main sections. Duodenum, the first part of the small intestine, approximately 10 inches, 25 centimeters long, receives chyme from the stomach, along with bile from the liver and gallbladder, and pancreatic juices from the pancreas. Major site for the chemical digestion of food. Jejunum, the middle section, about 8 feet, 2.5 meters long, has numerous folds, villi and microvilli to increase the surface area for absorption. Absorbs most of the nutrients including carbohydrates, proteins, and vitamins. Ileum, the final section, around 12 feet, 3.5 meters long, absorbs bile acids, vitamin B12, and any remaining nutrients. Ends at the ileocecal valve, which controls the flow of material into the large intestine. Histology. The small intestine has several layers, mucosa, the innermost layer containing villi and microvilli, which increase the surface area for absorption. Submucosa contains blood vessels, nerves, and lymphatics. Muscularis externa, 2 layers of smooth muscle, circular and longitudinal, that facilitate peristalsis. Serosa, the outermost layer, a thin layer of connective tissue. Functions. Digestion. Enzymes from the pancreas and bile from the liver break down carbohydrates, proteins, and fats. Brush border enzymes in the lining of the small intestine further digest nutrients. Absorption. Nutrients are absorbed through the villi into the blood and lymphatic vessels. Carbohydrates and proteins are absorbed as simple sugars and amino acids into the bloodstream. Fats are absorbed as fatty acids and glycerol into the lymphatic system. Immune function. Peyer's patches in the ileum contain lymphoid tissue that protects against pathogens. Clinical significance. Several conditions can affect the small intestine. Celiac disease, an autoimmune disorder where ingestion of gluten leads to damage of the villi, causing malabsorption. Symptoms include diarrhea, weight loss, and nutrient deficiencies. Crohn's disease, a type of inflammatory bowel disease, IBD, that can affect any part of the gastrointestinal tract, often the ileum. Symptoms include abdominal pain, diarrhea, and weight loss. Small intestinal bacterial overgrowth, SIBO. Excessive growth of bacteria in the small intestine can interfere with nutrient absorption. Symptoms include bloating, diarrhea, and malnutrition. Intestinal obstruction can result from hernias, adhesions, tumors, or strictures. Symptoms include severe abdominal pain, vomiting, and inability to pass stool. Irritable bowel syndrome, IBS, a functional disorder characterized by abdominal pain and altered bowel habits. Symptoms can be managed with dietary changes, medication, and stress reduction. Diagnostic and therapeutic procedures. Endoscopy, upper endoscopy, esophagogastroduodenoscopy, EGD, can visualize the duodenum. Capsule endoscopy allows for visualization of the entire small intestine. Imaging, CT scans, MRI, and barium X-rays can help diagnose structural abnormalities. Biopsies, obtained during endoscopy to diagnose conditions like celiac disease and Crohn's disease. Surgical interventions may include resection of diseased sections, bypass surgery, or removal of obstructions.